Singing River Health System is announcing a major milestone in heart health this week for them, and here to tell us more about this significant breakthrough and the WATCHMAN implant procedure actually is Dr. Hugo Quintana. Thank you so much, Dr. Quintana, for joining us.
Well, thank you for the opportunity. So we're proud to announce to our community the accomplishment of a major milestone. We have now implanted our 400th WATCHMAN device. So this is a testament to the team effort because there are several moving parts and several teams involved to the success and the commitment to the community, Jackson County, Harrison County, and surroundings of our system to bring forefront technology, preventive technology to improve the health and specifically to prevent the risk of stroke.
Yeah, I think it's great. I mean, this is, it helps prevent strokes, and it also helps people who are at risk of having problems because they are on blood thinners, of getting off of those blood thinners too, right?
That is correct. So this technology basically consists of a small device about the size of a quarter coin that is made out of a metal mesh and a cloth that it is intended to seal the entry point of the left atrial appendage. The left atrial appendage is a small cavity that exists in the upper chambers of the heart, where it is believed that 90% of the clots that cause strokes in people who have atrial fibrillation usually form. So it basically seals off the entry point, and so it serves as an effective and proven alternative to blood thinners for those individuals who cannot take blood thinners in the long run.
Now, do you reach that intravenously through the
groin
area, that kind of thing, like other heart
procedures?
procedures?
It's similar to a heart catheterization. It's actually performed through a percutaneous or through the skin puncture site or puncture that is performed in the groin area under local anesthesia, although the patient actually is fully sedated and intubated during the procedure. The procedure itself takes about 20 minutes, but from the time the patient comes in the room and exits the room is probably about an hour. And usually the patients go home either later the same day or the next day.
So how do you know if you're a candidate for this, because it is a preventative
Yes,
effort?
so definitely is not for everybody who has atrial fibrillation. The selection process is very laborious, and it takes multiple parties, several doctors involved. It is usually designed or believed to be beneficial in those individuals who have an increased risk of bleeding while they're on blood thinners. So those would be, for example, the ones who have already established gastric ulcers or colon lesions that are prone to bleeding, like diverticulosis, or in the elderly individuals who are at risk of falling.
Okay.
So those are primarily the candidates that, and then the other reality these days is that medications are expensive and blood thinners are very expensive, and sometimes affordability prevents proper compliance with medications. So those who have difficulties
complying. And this is a pretty low risk procedure.
It is a very low risk procedure. The success rate is in excess of 95%. The complication rate is certainly under 3%.
All right. Well, we have some information, I believe, about the celebration, and it is July 16th at 3 p.m. And if you want to learn more about this, you could come to that event.
That's certainly a possibility, and you can also
schedule an appointment with your doctor, and then and then end up perhaps in this gentleman's office at some point. All right. Well, Dr. Quintana, thank you so much for joining us.
No, thank you for the opportunity.